So Gary, you brought up a really interesting, I think, scenario that I'm guessing is really common, and that is you brought up you and your wife being out together, and as the person who's going through this recovery, obviously there are other people who go through things, with us, with you. How do you how do you manage, I guess, the surrounding people? Maybe part one is, family members, friends, and then at what point do do you go through this with everybody around you, and what's their role
Hmm.
in all of this? This is not a solo journey, I don't think.
This is a big question right here. And this is a big point to make. I believe that addiction is a family disease. The good news is it's also family recovery. So I was fortunate. I work with a lot of men and women who are quitting, but they're going through a divorce simultaneously. I could not imagine not having a partner next to me because that's the only thing I knew. My wife stood for me. She made it my own choice. If you oh, and by the way, a lot of people come to me after an event. They say my partner's drinking, and this is a big thing. I want to start there. Detach from the outcome, be a stand for what you know is right, and say, this is unacceptable. I'm not continuing this way. It's up to you whether you want to quit, but I'm not going to continue. That's called the way my wife delivered that. I give that to so many spouses at every event. It's like detach, make a stand, and then it's up to them. Because if you tell an alcoholic to that you should quit, what happens is we just get nastier and we get deeper inside of our stuff. But if I see I'm going to lose something, I didn't have an intervention. Well, I had my wife intervening. I didn't have a big intervention like Alan discussed, but like when you say this is what I stand for, this is what I stand against. If you want to do that, great. You're going to do that on your own. I'm going this way. So my wife told me, she goes, I'm moving back to New York to get our son healthy. By the way, what happened was I'm now 15 years sober because she was a stand. When you stand for nothing, you fall for everything. So you got to be a stand. Now, one of the things that I've learned too in helping alcoholics and spouses of alcoholics, there's an enablement that usually goes along with the person who's choosing to be with an alcoholic. So that's another type of program, the codependency that we work on. The codependency piece is what keeps alcohol in place. So in families. So we do a lot of work around interrupting the codependency piece because we'll see the spouse enabling. I mean, I have a guy who we worked with. She would bring his food. He would lock himself down in a basement with a gallon of vodka, put food and knock on the door and walk away, like to feed her husband. So at some point, like, and that's not magnified. That's continuous. So it's important to see the relationship you have with your spouse. The other thing I want to say is my son was diagnosed with autism. He couldn't speak at 5 years old. My wife said we're going to get, I got sober. We're going to get to work on this kid. He's now at Arizona State using his voice to be a sports broadcaster. And he's off the autism spectrum. Guys, I mean, this is, not coincidental. It's part of the recovery process of an entire family. And I share this because I'm so grateful to have a different life than what I thought we would have, a slippery slope of hell. Um, but it does get better once you take responsibility. Once I took responsibility, our whole life got better. So that's what's possible through this as a family. So it's a family disease and family recovery.
I would also say that when it comes to spouses, I mean, they've got a vested interest in your wins and your losses, obviously. I have to ask what your guys' take is about our really good friends that we have. So I'm a professional weight gainer and weight loser. And there's times when I'm, really working hard on wellness. And so that always entails not drinking. And so I've had, number one, I've been in plenty conferences and social settings where you ask for not a cocktail or you stick with water and you have to justify why you're not drinking. They look at you and you either have to say, religion, pregnant, because if it's just a choice, that's just odd. And then I've lost friends actually because I'm not as fun when I'm not drinking all the time. And so they'll be like, you want to go out to dinner? Yeah, sure. This date works. are you going to drink? Because if you're not, you know, it's not as fun. Like I've actually had people say that to me. And I'm like, all right, first of all, go fuck yourself. Number one, because I'm fun when I'm sober. But also, I mean, that's really, I mean, if I had an actual drinking problem, I mean, how unsupportive is that?
Well,
And so
that question, that's all about them.
Exactly.
They don't, okay, you know, Gary's seen this, and I will 22 years into this deal, and I like being around drunk people even less now than I did then.
Oh, yeah.
So let's just like, it drives me crazy. And mind you, I've run meetings that we had alcohol in. Not real proud of that, but I tend to fade out, and I just don't like being around it. That's fine. I know plenty of people that can be, and I can be all the time. But someone who's worried about if you're drinking, that's their problem. Like their anxiety is about, I mean, they feel comfortable drinking because you're drinking. If you're not drinking, that feels like a judgment to them. And my thing, the beautiful thing, Gary and I don't have to worry about this. Everyone knows we're not going to drink. I mean, so on some level, it hasn't been something I've had to worry about.
Yep.
The best thing in the world, the few times when, I got a great story. So I was at a meeting, and I was podcasting with some just legendary endodontists, John Cotomy and Abramson, just amazing endodontists. And we were going, and they wanted to go longer. They wanted to do another episode. So, and they all went and got drinks. And I had never talked to John, and they were drinking wine or whatever. It was like, I talked to John a bunch of times, but I never talked to him about alcoholism or anything like that. He brought me a sparkling water it was a really a gentle acknowledgement. I'm like, that's really cool. Like everyone kind of knows that I don't do that, but also, I don't know, for me, I don't love being around it, but on the other hand, there's plenty of times people drink a glass of wine or two and they don't get all wasted. So it's a matter of, I can deal with it, but a lot of times I choose not to, because I'm just kind of like, I don't really need to be around that, which is funny because I remember when I was new, I was commanded not to be around it because, of course, they're worried about you slipping into it, and that's also smart. But I will say this, as a dentist, there's something Gary didn't. I had some advantages over Gary because if I was going to keep, first off, I got into the treatment center, and the guy who ran the treatment center dialed the number for the Health Professions Recovery Program and handed the phone to me, didn't even tell me what it was. And I told them, yes, I'm in truth. So like I can say this, he basically turned me in. They're not really allowed to do that, but he did. So I was in the HPRP program before I ever started treatment. And so the reality is they wouldn't have let me go back to practice without being monitored. And I think that's really smart. Was it a pain in the ass to call every day to see if I needed to do a drug screen? Yes, it was. For 3 years straight, I had to get up or call at 5 o'clock in the morning, see if today was my day. And after a while, it was just part of my life. I went to meetings. I was already going to meetings, so I went to meetings. We did group therapy. It was, I kind of fell into the recovery culture like head first. I didn't even have kids then, so it was one of those things where I really had a chance to really sit in it, which was good for me. But dentists in particular, most states have a program like this where you can, and I think it's a smart thing to do, because here's the problem. If you get sober on your own, which is lots of people do, and you fall off the wagon and it becomes public, the classic thing is the news story of the dentist with the DUI or dental assistants using nitrous in their eye. Like that's a really rough. That's rough when it becomes public and you're not. But if you're on a contract and they're monitoring you, you've got some accountability built into that. And the other thing is, I knew that if I wanted to keep being a dentist, I had to jump through these hoops, which it's a bit of allowing someone else to have some control, because one of the problems with addiction is you sort of, you're responsible for the whole world. You're in charge of the whole world when you're an addict, and you think you are. So you think you can control everything. And of course you can't. So this was a really good exercise for me in a lot of ways, but also was a lot of protection, because I could literally point to the records I had. I said, look, I've been doing the right things for this long. And so I think it's smart. I think it's for people who are addicts. I don't think it's for people who it's really interesting. The difference between a DUI and 2 DUIs is the diagnosis of addiction or alcoholism. Like, you could potentially get a DUI and not be an alcoholic. Gary, what do you think the chances of getting 2 DUIs and not being an alcoholic are? I think they're none. I think there's zero chance. Like,
it's zero.
Because, like, are the consequences of 1 DUI for a non-alcoholic, is that enough that you would probably not drink and drive again. I think
No.
probably for most people, but for alcoholics, you go. I talk to people who've had 5 or 6 DUIs and no license. That that indicates something to me. Anyhow, I'm sorry. I'm just on a rant here.
It's great. Pam, I just want to jump in here real quick. There's 3 things that I studied: money, weight, and alcoholism, right? And really, there's something in that same book I told you I wrote when I got 3 years sober, something called our originating circles. And our originating circles, you pay attention to that, because the conversations that you were having with people when you were a certain weight, made a certain amount of money, and drank or not drank, what happens is those conversations become uncomfortable for people. Like, my nickname is Party Fresh. It still is. I'm still so much fun, but I don't do it with the same people. I have 5 friends that were my core friends that were always stayed with me. But the minute I dropped 30 pounds, I stopped drinking, I started making tons of money. That was uncomfortable for my originating circle, because we were in conversations called "this sucks, that sucks, this sucks, this sucks, that sucks, this sucks." It's sort of like going to a study club and, going, "Hey, are you doing well?" And they go, "No, yeah, I'm doing really well." Most people walk in there and go, "No, having a hard time with this, having a hard time with that, having a hard time with this." And it keeps the conversation down here. So I really study organizational behavior, because that's really what a dental office is. And when you really look at the dialogues, if you slice the roof of a house off or slice the roof of a dental office off and look down upon it, the quality of life is directly proportionate to the quality of interactions and conversations that are happening. And so when you really start diagnosing and studying this stuff, you can start seeing that it's going to be uncomfortable for some of your friends, and they usually deselect themselves from your inner circle, which is actually a gift. Oprah said it best. She said, they said, "Why are you failing?" Oprah, when she went from her show to a channel. And she said, "Because when you climb higher mountains to the higher altitudes, not everybody has the same lung capacity to deal in the higher altitudes." So I really, really connected with that. And that's what happens when you're evolving. Some people get left behind. Reason, season, lifetime, people stay with you.
Wow. So, okay, not fitting in is kind of really, we're keep circling back to this. Gary, you kind of started off with it with like an internal feeling. And then Alan, you picked up on it when you were sharing with Pam, like, hey, that's somebody else feeling the worry of not fitting in because you're choosing not to drink. And now, full circle, Gary, the conversation of as in recovery, as you get to a different place, like maybe you're in different circles of people. And Alan, you kind of alluded to like, hey, I don't really want to be around people who are getting really drunk because there's that not whole fit. So is 2 guys who've really overcome, and people who are listening to this who feel like I don't fit in right now, and maybe I'm identifying with a past life that you've come to a new place in and evolved past. What advice would you give to them to find the right circles of people so they feel like they fit in and they can, move to a better place for themselves when they feel like, I don't know how to live without whatever it is they're struggling with?
Alan, you want to jump in? Or
Yeah, I have some thoughts. This is a whole other podcast in itself. But like when I was using, there was no such thing as social media. Like the trap, the comparison trap that we all face every day with the smartphone in our pocket or whatever. That would be so much harder. Wow, that'd be so much harder. Like on some level, I'm glad I got clean back when I did, because there wasn't even. Now there are sobriety influencers. Who knew, right? So I feel like. Okay, so what social media has done to me a little bit, and is that a lot of my close friends are no longer, they're not IRL friends necessarily. In other words, they're not people I could necessarily go to lunch with. A lot of them are across the country and all that stuff. And I would find it really important to make sure you've got some people that you can go to lunch with, that you can put your hands on, that you can talk to. Some of those people are people I've met in the program, now. But I feel like it's really nice to have friends you can say whatever you need to, that sort of thing. And I gotta say, between COVID and social media, it's hard to make friends as a grown up. It really is. You know, like it's great if you've got a circle of friends you've had forever, but boy, oh boy, it's hard and weird making friends. Now I say that as someone with 22 years in recovery, I have a hard time making friends. You know, it's in real life friends. I got social media's a piece of cake, but so understand that like real people are real people and strive to find those. As far as not fitting in, I've never really felt like I've fit in. But as a dentist, you know, we're pretty good at the show, right? I mean, like you might not be feeling it every day that you go in to be a dentist, but you can't. That's not something you're going to necessarily let your patients know. So we're pretty good at the show. So understand. I think it's really important to understand when you're putting on the show, when the show is going, and I do that a lot. You know, like and understand when you know, find some people that you can be around that you don't have to put the show on for necessarily. That's what I would recommend. I think
That's super powerful. I I had a mask on. You prompted a thought of like how I used to mask up, armor up,
Mhm.
show up in the world. And actually, you spoke about it earlier before we were prepping today. It's like people are attracted to transparency, vulnerability, and authenticity.
Mhm.
I used to think like I had to go up on stage and have all the answers. Now, people connect with what like, I guess a superhero all has a kink in their armor. I, the opposite of addiction is connection. So I want to say that again and highlight that. The opposite of addiction is connection. Because addiction, you're isolating and self-centered and trying to control the world around you. When you're in the healing process, it's about being connected. So what I would suggest is I tried to, leading up to like the final day of last day, I was trying to rearrange my outsides to feel better on the inside. You can never, ever get there. More money, more time, more sex. You swear today, Pam. I fucking love that when you swear. I hope I don't get bleeped out.
I'm in New Jersey. I am. I can't
I'm
help
Jersey too,
myself.
but I love swearing, especially on podcasts that allow it, because here's what I've learned. I used to because I didn't think I belonged, I used to over try to have people like me, overcompensate, over love people, over. And then I would just get hurt. That's just a nightmare. When you just rearrange your insides and start going to work over here, what happens is you don't have to promote yourself. People come to you and are attracted to you. I have the best friends in the world. We never drink. It's so funny. It's called a filter. We filter when we're drinking. All we can see is people drinking. When you stop drinking, all I can see is, holy crap, I don't see anybody drinking anywhere anymore. Just because I don't have my intention and attention on this damn thing that had me. Now I have it. By the way, I think somebody said earlier, you never get over this. I never get over this. This is always going to be present for me. And I have to keep that in the forefront, that my disease is doing push-ups and is like Schwarzenegger ready to kick my ass again. And I have to hold it in that perspective, because otherwise I'm going to let down my guard and the game's going to be over. But, going back to your question, like what's the advice? Go to work on the inside job. And that's the last place most people want to go.
So, all right. You mentioned earlier about the dental assistant that lost their license. And Alan, you were talking about how you kind of got called out without even realizing it with that phone call. Do you think that just dental boards in general are a little too lenient on dentists? I mean, since this is a legitimate concern among dentists, are they too lenient on us? Should more dentists lose their licenses? And like, how so?
dental boards are there's not a dental board if addiction is the problem and it comes to a dental board, unless there's been crime or other bad things, there are no dental boards that will take your license away for being an alcoholic. They will send you for evaluation and treatment. It's really funny. That's like the worst kept secret, is the fact that no one actually loses their license for being an alcoholic unless they refuse treatment, and they keep, like, in other words, if the I've dealt with this so much. And one of the reasons, honestly, I left being the committee for the MDA is because the MDA had no teeth. So we could try and help people, but if they didn't want help, we couldn't do anything more. Like, and then, but the boards were in the same position. The boards would refer them to, for evaluation and treatment. It's just a weird thing. That's been my experience. Now, I could be wrong about that, but like my thing is like, if you're a dentist and you get a DUI and you crash your car and you injure someone and you're going to get in trouble for the things that you did, but they're not going to take your license away because you're an alcoholic unless you go for treatment, unless you're referred for treatment and you refuse treatment. I am certain of that. Here's the thing. Everyone thinks that if they have to stop drinking and go into treatment, then that is going to be a huge, like they'll have to be. I was away for 4.5 months. I was in some of the best treatment they had. And I had a father who came in and took care of my practice while I was gone. I was lucky. But it doesn't always have to work that way. The story is like every dentist you ever run into that's like in a position where they might have to go into treatment, they are worried about their livelihood, which, I mean, as well they should be. But there are a lot of ways to work around this, not the least of which there's, a lot of local dental organizations can help support, that sort of thing. The problem is everyone wants to keep it quiet. No one wants to be honest about what's going on. So it's like and I do think sometimes I got to keep this quiet thing is one of the things that really foils us. I have never had a regret from being open about my recovery. And the first time I told my story at a Michigan Dental Association meeting in 2005. So like I've been doing this for a while and I still have no regrets about it because it's, as Gary said, it's much easier to be transparent. It's much easier. All I did was lie while I was using, and it was hard to keep track of all the lies. But if you don't lie about the stuff, then you don't have to worry about what you told who, it's just right out there in the open. And on some level, people are so afraid that they'll have to change everything in their dentistry. There are plenty of dentists that have gotten clean and sober and have been able to do this and still maintain their office, their practice, their team. I mean, I have team members that are with me now that were with me when I was using. I mean, like I got team members that came into treatment with me. Like they literally came for family day. That was a blast. It was a good time. Like you get to see the the people that you worked around get to explain what it was like to be around you while you were using. Like that's rough stuff, and they're still with me. The reality is that it actually gets better, but it's a matter of being open and honest about it. Like as soon as you start trying to hide it from everyone, it's a lot harder. It's a lot harder to get it done right. So, do I think that dentists need to realize that like because they're an alcoholic doesn't mean they won't, they're going to lose their license. Well, people that lose their license from this are the ones that won't get help. That's what I've found. Gary, am I right about that?
There's no doubt about it. It's like, let's just be really clear. Alan, I thought that was a great take. If you're putting things in the way of your sobriety, just stop doing that. Just cut it out and raise your hand, ask for help. And there's so many people that are willing to mobilize if you just get straight about what you're dealing with. People will mobilize around you. I can't tell you how many times we've had people, docs go out for 6 months, and we had docs come in. We had a whole system built. They made it through because again, I have docs, you guys know, that can't take a week off when they first meet us. They go, I can't take a week off. My whole thing's going to fall apart.
Yeah.
So that goes, by the way, if you're saying that and that's your justification, get help. Reach out to one of us. We'll walk you through, take you by the hand and walk you to the other side, because that's an indicator. Start making yourself first. I know we usually pay ourselves last in dentistry, not here. You get to take care of yourself first. Put the oxygen mask on you and watch the world change in a positive way. And there's hundreds of men and women that I know of that have done that. And they came to us and they couldn't take a day off because they thought they would crash everything. So I get you out there. I get you. I feel you. I see it every day. And just note that you're not alone. You don't have to be alone, and you don't have to suffer anymore. You really don't if you just raise your hand. And I know that hand might feel like a 5,000-pound weight, like just picking up the phone trying to call somebody. But I want to make myself available to anybody in dentistry, and I'm happy to listen to your story with no judgment, nothing, zero, not a zilch, only to hear what you want and give you some direction, because somebody gifted me that, and I want to be able to give it away to somebody else. And that's basically what I've dedicated my career to in dentistry.
I love that so much. I love this so much. So for every moment anyone who's listening has ever felt alone and you've ever felt like you didn't fit and you didn't belong, I think if we're all very honest, we've all felt that emotion too many times to say out loud. I can't, Pam, I know I'm speaking for you. We can't thank you both enough for being here and sharing your story and being honest that we've all felt that feeling, and there is a path and there are people and we want to help. So thank you so much for being here. Thank you for sharing your stories, and thank you for giving some like real solid advice in addition to sharing your stories of steps people can take, because there are steps we can take. Pam?
Yeah, I certainly agree. I thank you guys so much for your sharing your stories, but also I think giving people a helping hand and also giving them hope to know that, there, obviously if you are feeling shame or you feel like you can't do it, there are people who have, and it's not because, although I believe you guys are very special and you're very special to me, but not because you have a superpower that not other people don't have. And so certainly I know when it comes to anything I do, I'm like, if I can do it, anyone can do it. And I would imagine that this sentiment, transcends that message as well. So I guess, we'll certainly share helplines. Would you guys be willing to share your email addresses or a way people, can reach out to you if they would, they need to reach you?
Happy to do it. Yeah. I'm Gary at nextlevelpractice.com, and I'm going to give you my personal cell phone because I believe that this is a serious issue, and please call only if you're serious, but it's 480-620-3446, 480-620-3446.
My email address was actually inspired by recovery. Simple but not easy at gmail.com. Simple but not easy at gmail.com. My cell is 989-859-6302, and it's out there. Like, Gary, I don't get a lot of calls from people, but I like to put it out there anyhow. But simple but not easy at gmail.com is the easiest way to get in touch with me, and I'm happy to help. And honestly, understand the helpline stuff is there, but your state likely has a program. Most of them do. So, and that's, maybe we can help people find that stuff too. But you're still like there. You won't be the first person that's ever dealt with this if you decide you need to. Like, the great news is there's plenty of people that came before you, so they've kind of got a way for people to do this in most places.
Yeah. And, just last thing on the stigma, it's like, you're not a bad person because you have an addiction. It's just what you have. And then there is just steps to take. And if you can boil it down to there and stay out of your head and take a step, that first phone call can change your life. It did for me, and I know it did for Alan. And it's like, ladies and gentlemen, Pam, David, thank you for doing this work and bringing what I think is one of the most important things in dentistry to the forefront and getting it out there in the world. So thank you for the work that you guys do as well.
Thank you. I feel like now is a great time for a quote from RuPaul. If you don't love yourself, how in the hell are you going to love somebody else? And if we can't be good to our patients and our family and everybody else if we're not good to ourselves. So, David, this was a really great 2 weeks. And thank you guys so much for spending your time with us. And we will see you on Dentistry Unmasked next week.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.